We just heard how new technology is making diagnosing issues for those with pacemakers easier. But what is a pacemaker, and why does someone need it? Dr. Miguel Bryce with Florida Hospital Waterman Heart Center explains that pacemakers are used to help those with irregular heart rhythms by keeping their heart contracting and blood pumping adequately.
The heart rhythm of the heart by itself, the heart requires a normal beat, a heartbeat. The heartbeat is an electrical impulse that goes through every cell in the heart in which it generates. It's like a kind of an engine. I mean, we need the blood flow, like we need the gasoline, we need the muscle, we have, the engine itself, and we do need the spark plugs and the whole electrical wiring and the battery in order to keep the heart beating. So obviously when something goes wrong with that, there's a problem. It can be a problem in which the heart goes very slow. It can be a problem in which the heartbeat goes too fast, to the point that it can be life-threatening fast if it's a rhythm, malignant rhythms, especially those that come from the lower chambers of the heart, as well as it can be very irregular or fast. And some of those irregular fast heart rhythms and also has a link with a risk of a stroke, risk of heart attacks, risk of heart failure, which is a weakening muscle of the heart, as well as those problems can trigger rhythm problems. So it's a very close relationship between rhythm problems and heart problems. The most common reason why we end up having rhythm problems is probably because we have circulation problems or prior damage to the muscle of the heart, either by a lack of circulation, by heart attacks, or by other toxins or certain medications. If we determine that it's a heart that beats too slow, it's with pacemakers. Obviously, technology has developed substantially. We have been acquiring new equipment in which we can get it more accurate with less radiation exposure to the patients. New technology that give us kind of a GPS while the catheter is in the heart on real time, for which we don't need to use as much X-ray as you normally would use in the past, and as well as increase the success rate of these procedures, decreasing all kind of risk of complications for the patient.
According to the CDC, the incidence of atrial fibrillation increases with age. The median age for patients with AFib is 67 years for men and 75 years for women. For more information on the treatments and cardio rehab services available at Waterman's Heart Center, please click the Rhythm of the Heart story link on our homepage at yourhometownhealth.com.